Cardiovascular disease is any disease of the heart or blood vessels. This includes hypertension, coronary heart disease, and heart failure. It is also the leading cause of death and disability for Aboriginal Victorians. Cardiovascular disease is one of the 4 preventable chronic conditions that largely contribute to the growing life expectancy gap between Indigenous and non-Indigenous Victorians. Compared to non-Indigenous Australians, Aboriginal and Torres Strait Islander people were 70% more likely to die from CVD. In Victoria, it has accounted for 25% of deaths, making it 1.5 times more likely for an Indigenous Victorian to pass away from this condition compared to a non-Indigenous Victorian. The risk of developing cardiovascular diseases can be due to advancing age, genetic predisposition, gender, and ethnicity. However, some modifiable risk factors include behavioral choices such as smoking, sedentary lifestyles, poor diet, and excessive alcohol consumption. The impact colonization has had on Indigenous population is significant. Prior to colonization, Indigenous people lived an active lifestyle of hunting and gathering food that were rich in nutrients. They had no exposure to the adverse effects of alcohol and tobacco until the arrival of British settlers. They were introduced to foods high in carbohydrates and saturated fats, no longer having the exposure and therefore the enjoyment of high nutrition of food they were familiar with. They were dependent on rations provided to them as it was the only source of food and energy they were provided. Additionally, Aboriginal people's exposure to alcohol and tobacco was also introduced due to colonization, as it was used to trade by colonists for sex and labor from the Indigenous Australians. Post-colonization, these newly adapted westernized lifestyles that were introduced to them caused for a difficult time for some to be able to break free from these bad habits, therefore deteriorating their health and increasing the prevalence of conditions such as cardiovascular disease. It has been estimated that more than 6 years of the life expectancy gap could be removed if Aboriginal Australians experience the same level of cardiovascular health as non-Aboriginal Australians. So what can be done about it?
We had the pleasure to come into contact with an elder from the Wurundjeri tribe. In order to respect their wishes of remaining unidentified, we will be referring to them as LG. LG is 50 years old and has a family history of suffering from cardiovascular diseases. They originated from the Wurundjeri tribe in the Dandenong community. We asked what impact colonisation had had on their health, to which LG explained hunting and gathering was a tradition that colonisation stripped from their community, impacting their health significantly as they lost access to foods that were rich in nutrients. LG stated that a holistic approach among the healthcare system is a good concept as it provides better healthcare for their community. However, there are still some negative aspects. LG has been faced with insensitive comments such as, I didn't realise Aboriginal people lived here, and what percentage of Aboriginal are you? LG explained that cardiovascular disease runs in their family. They manage their condition through regular checkups at their local Aboriginal health service. When asked about the services the Aboriginal liaison officers provide, LG said that their community feels more comfortable and supported with an Aboriginal liaison officer there. They help to keep everyone updated of their appointments and answering questions that they may have. LG feels safer in the healthcare system knowing that an Aboriginal liaison officer is present, and without one, LG finds it difficult to undergo treatment or keep track of their appointments. We asked LG if there were any recommendations they could make about improving healthcare for the Aboriginal and Torres Strait Islanders. LG replied, I recommend it's important to have Aboriginal health worker roles in the healthcare system and also to use Aboriginal healthcare services as much as you possibly can.
After learning about LG's story, we decided we needed to take action. The Lighthouse Hospital project aims to drive change in the acute care setting through implementing activities that improve the care and outcomes for Aboriginal and Torres Strait Islanders suffering through coronary heart disease. It is a joint initiative of the Heart Foundation and the Australian Healthcare and Hospitals Association and is funded by the Australian Government through the Indigenous Australians Health Program. There are a disproportionate number of deaths from coronary heart disease in Aboriginal and Torres Strait Islander people compared to non-Aboriginal people. Aboriginal and Torres Strait Islander people are also more likely to be admitted to hospital for acute coronary syndrome episodes. Although they have higher admission rates, they are also more likely to die in hospital or leave against medical advice. In the first phase of their program, they identified cases that highlighted the best practice of care among Indigenous people experiencing ACS. In the second phase, they aim to drive systemic change in acute care hospital settings to improve care and outcomes for Aboriginal and Torres Strait Islander peoples experiencing ACS, involving themselves with hospitals such as St Vincent's Hospital here in Victoria. Through this phase, they developed a toolkit that aligned with current major key policy and initiatives to ensure best practice in provision of care for Aboriginal and Torres Strait Islander people with cardiovascular disease. Phase 3 of the Lighthouse Hospital project was announced in 2017, which aims to reduce the incidence and impact of discharge against medical advice among Aboriginal and Torres Strait Islander people by supporting hospitals to ensure the provided care that is evidence-based, responsive and accessible, clinically appropriate and most importantly, culturally safe. In this phase, they also became involved with Barnsdale Regional Health Service in Victoria. To respect LG's wishes of a great healthcare system, we collaborated with the Lighthouse Hospital project to involve the Dandenong Hospital, paying respect to the location of where LG's tribe originated from. By involving this hospital, we hope to decrease the rate of mortality and morbidity in Victorian regions amongst Aboriginal and Torres Strait Islander people. The introduction of Dandenong Hospital and our services will hopefully aim to reach over 1 in every 3 Aboriginal and Torres Strait Islander people admitted to hospital for a cardiac condition. The goal is to improve the integration of health services and care coordination by strengthening relationships between hospitals, local Aboriginal community services and primary health networks. The services we are introducing are a free shuttle bus service to anyone in need of travelling to hospitals but are unable to do so themselves or find it very overwhelming. At-home services, where if the patient does find travelling uncomfortable, we have qualified Indigenous staff that can come to you and complete your appointment in the comfort of your own home, equipped with adequate resources to complete the care to a high quality. A large number of Aboriginal liaison officers in order to ensure our Indigenous patients have someone to advocate on their behalf and overall are comfortable, feel supported and empowered. A cardiac care unit specifically for Aboriginal and Torres Strait Islander admissions where most staff are Indigenous. This will consist of 18 beds and staff from all tribes to ensure we have covered most local languages for our patients to feel safe and comfortable. Ongoing treatment packs, including posters, brochures and booklets in English and the patient's traditional language to aid in them monitoring their condition and learn more about their condition once discharged. And at-home checkup services, once discharged in order to avoid the patient having to travel vast distances.